Previously on Happily Ever After.
I'm dirty. I mean, I massage him all the time. He never massages me back.
Yeah, she massages me.
Court dismissed! Bring in the dancing lobsters!
I'm an eclectic therapist, and I've specialized in this kind of therapy for 15 years. Hi, nice to meet you. I'm Dr. Sprinkles.
I'm Tinkerbell.
Hi, Tinkerbell.
Oh, hi. Oh, it's you.
And you are?
Peter, obviously.
Peter. Yeah. So, what seems to be the problem here?
I don't have one.
That seems to be the problem. I just feel like our relationship isn't really what it once was. You know, back before, like, Captain Hook got his hand, cut off, I felt like we had something.
Mm-hmm.
I felt like we had something. Then, Wendy came. Wendy left. I just don't know. We need help.
Yeah. And how did that make you feel, Wendy, being there?
Not loved. Not loved.
Peter, do you have anything to say?
Well, I mean, she's obviously troubled. You really do need to help her.
Wow. I just think that, we need to get everything out there. We need to talk about this, and things will work out. So, Peter, I haven't heard anything from you so far.
But this isn't for me, it's for her.
No, it's for your marriage, right?
Yes. Please don't do.
So, right now, I think it's best if I split the two
You
of
want
you
to
up.
split us up?
No, not in that way. I was thinking more like, divide and conquer. No. Well, Dr. Sprinkles always work. I mean, look at my clients. Anyway, so divide and conquer. So, Tinky, if you could you please step outside?
Wait, with me?
Well, you're staying inside. We're going to have some one-on-one talking.
I think that we do need to discuss her.
Okay, just for a few minutes. Thank you, Tinky.
I think the therapy is going okay. I mean, I don't really need it. I'm perfect. But Tinkerbell definitely needs it. She started like this pixie dust regimen.
I tried pixie dust like 6 months ago. A friend said it was really good. I tried it. I thought I could fly. And then I tried it again. Still thought I could fly. I can't fly.
It's so obvious that Peter is antisocial, narcissistic, and that Tinky has an anxiety disorder. So, Peter, how are you feeling?
I feel like the big strapping green god that I am. I think our therapist is kind of dumb. She keeps asking me all these questions, but she doesn't see that I'm perfect.
How long have you felt this way?
I was born fabulous, what can I say?
Unconditional positive regard. Unconditional positive regard. Oh, okay, well, Peter, I'm done with you for now. Could you please go outside and get Tinky, and I'll start my one-on-one with her.
Sure.
Thank you. I think we're really making some headway with Peter here. Peter's antisocial personality disorder and narcissism might be caused by the lack of fulfillment of the love and belonging part of Maslow's hierarchy of needs. So, Tinky, I'm sensing a lot of unhappiness in you. What's the source of all that?
I feel anxious all the time. It just doesn't go away. It's with everything, but mostly it's centered around Peter. I don't feel like he really loves me anymore. Actually, I don't know if he ever really loved me. He spends a lot of time looking at himself, is what I'm saying. It hurts. I tried pixie dust. Bad decision. Other than that, I don't know. I've been anxious for as long as I can really remember. I'm anxious kid. Anxious teen, anxious now, anxious fairy. I want answers. Just please tell me what's wrong. I just feel like with all of this, I talk about my feelings. You ask me if that's how I feel. Obviously it is what I feel, otherwise I wouldn't be talking. I just want answers, and I just feel like you're not giving me them. I don't know. I can like feel my relationship deteriorating while we speak.
Well, Tinky, I could prescribe you some anti-anxiety meds. In addition to being a humanist, I'm also a biologist, so if that would work out. How would you feel about that?
Dr. Sprinkles, I want to give it a try.
So Tinky, I'm gonna prescribe you some Xanax, hoping it's gonna depress your nervous system and lower the serotonin levels in your body. So yeah, hopefully it all goes well. Here is your prescription. And if they ask who your psychiatrist is, just say it's Dr. Sprinkles. Have fun.
Oh hey, didn't see you there. It's Tinkerbell again, and I've learned a lot in the past 6 weeks after couples therapy. 2 things come to mind. One, me and Peter just definitely shouldn't be together. He's kind of a horrible person. Secondly, Dr. Sprinkles, terrible doctor. Turns out she's not an actual psychiatrist and can't legally prescribe me drugs. And the drugs she described, Xanax, you're only supposed to take them intermittently to treat generalized anxiety disorder because they can become highly addictive. Secondly, I don't know why I went there in the first place, because a humanist is not really the correct treatment for generalized anxiety disorder. What you want to do is a combination between cognitive behavioral and some sort of selective serotonin reuptake inhibitor, SSRI. Specifically one like Paxil, that it works to correct the serotonin imbalances in someone like mine's head. So that combined with cognitive behavioral therapy, something like exposure therapy. Pets can also be really good for treating generalized anxiety disorder. But again, the main things that you want to do and why you wouldn't use Xanax is a combination between an SSRI and cognitive behavioral therapy.
I'm still perfect.